Overview of arrhythmias. Arrhythmias represent a group of disorders characterized by irregularities in the normal rhythm of the heart. The heart's rhythm is orchestrated by a complex interplay of electrical signals that coordinate the contraction and relaxation of its chambers. When this intricate system is disrupted, it can lead to abnormalities in heart rate and rhythm, giving rise to arrhythmias. Understanding the basics of arrhythmias involves exploring their classification, underlying mechanisms, and the impact they have on cardiovascular health. Classification of arrhythmias. Arrhythmias are broadly classified into two main categories: atrial and ventricular. Atrial arrhythmias. Atrial arrhythmias involve irregularities in the electrical activity of the atria, the upper chambers of the heart. Common types include atrial fibrillation, AF, atrial flutter, and supraventricular tachycardia, SVT. AF in particular is a prevalent arrhythmia associated with an irregular and often rapid heartbeat. Ventricular arrhythmias. Ventricular arrhythmias originate in the lower chambers of the heart, the ventricles. Ventricular tachycardia, VT, and ventricular fibrillation, VF, are examples. Ventricular fibrillation is a life-threatening emergency as it can lead to cardiac arrest if not promptly addressed. Underlying mechanisms. Abnormal automaticity. Normally, the heart's pacemaker cells in the sinoatrial SA node generate electrical impulses at a controlled rate. Abnormal automaticity refers to cells outside the SA node generating impulses, disrupting the heart's rhythm. This phenomenon is common in atrial and ventricular arrhythmias. Re-entry circuits. Re-entry circuits occur when an electrical impulse circulates repeatedly through the same pathway, causing the heart to beat in a rapid and often irregular manner. This mechanism is often implicated in supraventricular tachycardias. Triggered activity. Triggered activity involves abnormal electrical impulses that arise due to after depolarizations, which can lead to premature heartbeats. This mechanism is associated with conditions like torsades de pointe, a specific form of ventricular tachycardia. Conduction block. Conduction block occurs when the normal conduction of electrical impulses through the heart is impeded, leading to slowed or blocked signal transmission. This can result in bradycardias or certain types of heart blocks. Impact on cardiovascular health. Arrhythmias can have significant consequences for cardiovascular health, including impaired hemodynamics. Arrhythmias can compromise the heart's ability to pump blood effectively, leading to reduced cardiac output and potentially causing symptoms such as fatigue, dizziness, and shortness of breath. Thromboembolic events. Atrial fibrillation, a common arrhythmia, is associated with an increased risk of blood clots forming in the atria. If these clots travel to other parts of the body, they can cause stroke or other thromboembolic events. Sudden cardiac death. Certain ventricular arrhythmias, particularly ventricular fibrillation, can result in sudden cardiac death if not promptly treated. This underscores the urgency of addressing life-threatening arrhythmias through interventions like defibrillation. Understanding the intricacies of arrhythmias is crucial for healthcare professionals in diagnosing and managing these conditions effectively. Advances in technology and research continue to refine our understanding of arrhythmias, leading to improved diagnostic methods and innovative treatment strategies aimed at enhancing patient outcomes. Diagnosis and monitoring of arrhythmias. Accurate diagnosis and continuous monitoring are pivotal in managing arrhythmias effectively. A variety of diagnostic tools and monitoring techniques are employed to identify the type, severity, and frequency of arrhythmias, providing crucial information for the development of appropriate treatment plans. This section explores key modalities used in the diagnosis and monitoring of arrhythmias. 1. Electrocardiography, ECG or EKG. ECG is a foundational tool for the diagnosis of arrhythmias, providing a snapshot of the heart's electrical activity. 12-lead ECG. The standard 12-lead ECG records electrical signals from different perspectives, offering a comprehensive view of the heart's rhythm and identifying abnormalities in atrial and ventricular activation. Ambulatory ECG Holter monitoring. Holter monitoring involves the use of a portable device that continuously records ECG signals over an extended period, typically 24 to 48 hours. This is particularly useful for capturing intermittent arrhythmias that may not be evident during a standard ECG. Event recorders. Event recorders are similar to Holter monitors but are typically worn for longer durations. Patients can activate the recorder when they experience symptoms, allowing for the correlation of symptoms with ECG data. 2. Implantable cardiac monitors. Implantable devices offer long-term monitoring for individuals at risk of recurrent or asymptomatic arrhythmias. Implantable loop recorders, ILRs. ILRs are small devices implanted beneath the skin, usually over the chest. They continuously monitor the heart's electrical activity, automatically detecting and recording arrhythmic events. ILRs are especially useful for patients with unexplained syncope or those at risk of atrial fibrillation. Implantable cardioverter defibrillators, ICDs, and pacemakers. ICDs and pacemakers not only treat arrhythmias but also serve as diagnostic tools. These devices continuously monitor the heart's rhythm and can provide valuable data for clinicians to assess arrhythmia burden and response to therapy. 3. Electrophysiological studies, EPS. EPS involves the introduction of catheters into the heart to assess its electrical properties and provoke arrhythmias for diagnosis. Mapping and ablation. EPS is often combined with 3D mapping technologies to identify the origin of arrhythmias. In some cases, radiofrequency ablation may be performed during the procedure to eliminate the abnormal electrical pathways responsible for arrhythmias. Tilt table testing. Tilt table testing is employed to evaluate conditions like vasovagal syncope. The patient is placed on a table that can be tilted to provoke changes in heart rate and blood pressure, aiding in the diagnosis of certain arrhythmic conditions. 4. Advanced imaging techniques. Imaging modalities such as cardiac MRI and CT angiography can provide detailed anatomical information and assess the impact of arrhythmias on cardiac structure. Cardiac MRI. Cardiac MRI can reveal structural abnormalities, assess myocardial function, and aid in the diagnosis of conditions such as hypertrophic cardiomyopathy that may predispose individuals to arrhythmias. CT angiography. CT angiography is valuable in visualizing coronary anatomy and identifying potential causes of arrhythmias, such as coronary artery disease. Wearable devices and mobile health, mHealth. Advancements in technology have facilitated the development of wearable devices and mHealth applications for continuous arrhythmia monitoring. Smartwatches and wearable ECG devices. Devices like smartwatches equipped with ECG functionality allow individuals to record their heart rhythm and share data with healthcare providers. These tools are particularly valuable for the early detection of atrial fibrillation. Mobile applications for symptom tracking. Mobile apps enable individuals to track symptoms, lifestyle factors, and medication adherence. This information can aid healthcare providers in assessing the impact of arrhythmias on daily life and tailoring management strategies accordingly. The diagnosis and monitoring of arrhythmias involve a multifaceted approach, integrating traditional ECG assessments with advanced technologies and invasive procedures. These modalities not only aid in confirming the diagnosis, but also guide treatment decisions and contribute to ongoing research efforts aimed at improving our understanding of arrhythmias and optimizing patient outcomes. Management strategies for arrhythmias. Effectively managing arrhythmias requires a comprehensive approach that addresses the underlying causes, alleviates symptoms, and prevents complications. The management of arrhythmias spans lifestyle modifications, pharmacological interventions, and in certain cases, invasive procedures. This section explores key strategies employed in the management of various types of arrhythmias. 1. Lifestyle modifications. Certain lifestyle changes can contribute significantly to the management of arrhythmias, improving overall heart health and reducing triggers for abnormal heart rhythms. Healthy diet. A heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins is recommended. Limiting the intake of processed foods, saturated fats, and excessive caffeine can help manage arrhythmias. Physical activity. Regular moderate exercise is generally beneficial for heart health. However, individuals with certain arrhythmias may need to discuss their exercise regimen with healthcare providers to ensure it is safe and appropriate. Stress management. Chronic stress can contribute to the exacerbation of arrhythmias. Stress management techniques such as meditation, deep breathing exercises, and yoga may be recommended to reduce stress levels and improve overall well-being. 2. Pharmacological interventions. Medications play a crucial role in controlling heart rhythm and preventing complications associated with arrhythmias. Antiarrhythmic medications. These drugs are designed to stabilize the heart's electrical activity and prevent the occurrence of arrhythmias. Examples include beta blockers, calcium channel blockers, and sodium channel blockers. The choice of medication depends on the specific type of arrhythmia and individual patient characteristics. Anticoagulants. For certain arrhythmias, such as atrial fibrillation, where there is an increased risk of blood clots, anticoagulant medications, blood thinners, may be prescribed to reduce the risk of stroke. Rate control medications. In cases where restoring a normal rhythm is challenging, medications that control the heart rate without attempting to convert the rhythm may be used, particularly in atrial fibrillation. 3. Invasive procedures. Invasive procedures are reserved for cases where medications alone are insufficient in managing arrhythmias. Catheter ablation. Catheter ablation involves the use of radiofrequency energy to destroy or isolate the abnormal electrical pathways responsible for arrhythmias. This procedure is commonly used for supraventricular tachycardias and certain types of atrial fibrillation. Implantable devices. Devices such as pacemakers, implantable cardioverter defibrillators, ICDs, and cardiac resynchronization therapy, CRT devices can be implanted to regulate heart rhythm, prevent sudden cardiac death, and improve overall cardiac function. Surgical interventions. In certain cases, open-heart surgery may be recommended to correct structural issues contributing to arrhythmias. For example, the Maze procedure is a surgical technique used to treat atrial fibrillation by creating scar tissue to block abnormal electrical pathways. 4. Lifestyle monitoring and patient education. Empowering patients with knowledge about their condition and promoting self-monitoring are essential components of arrhythmia management. Regular follow-up. Patients with arrhythmias require regular follow-up with healthcare providers to monitor the effectiveness of treatment, adjust medications, and address any emerging concerns. Symptom recognition. Educating patients to recognize symptoms such as palpitations, dizziness, or chest pain is crucial. Prompt reporting of symptoms allows for timely intervention and adjustments to the treatment plan. Emerging technologies and innovations. Advancements in technology continue to impact arrhythmia management, with ongoing research exploring novel interventions. Leadless pacemakers. Leadless pacemakers, which are smaller and do not require leads, represent a technological advancement that may reduce complications associated with traditional pacemaker implantation. Focused ultrasound, FUS, ablation. Focused ultrasound is being investigated as a potential non-invasive method for ablating tissue responsible for arrhythmias, providing an alternative to traditional catheter ablation. In conclusion, the management of arrhythmias is a dynamic and individualized process that requires collaboration between healthcare providers and patients. The integration of lifestyle modifications, pharmacological interventions, and, when necessary, invasive procedures allows for a tailored approach that optimizes patient outcomes and enhances overall quality of life. Ongoing research and technological innovations continue to shape the landscape of arrhythmia management, offering new possibilities for improved patient care.